current system of health care provision in this country is not working. The Congressional Budget Office has estimated that job-based health insurance could increase an additional 100% over the next decade. Employer-based family insurance costs for families of four by the year 2018 will approximate $25,000 unless something is done. And at the same time, for the 2/3 of families in this country with incomes of less than $67,000, obviously purchasing health insurance would be totally unaffordable if it isn't already. The net effect of rapidly rising health insurance premiums for most families is that workers are essentially getting a pay cut, as the share of their income devoted to health insurance and health care costs are growing at a pace that's clearly outpacing inflation and the growth of wages in real dollars. The Congressional Budget Office estimated that the growth of Social Security and health care costs, combined with the aging of the boomer generation, will create ever larger federal deficits. In turn, higher deficit spending will cause a higher percentage of the budget to be spent on interest on the public debt. And this will require ever deeper cuts in the discretionary spending to achieve a balanced budget. What does less discretionary spending mean? It means less spending on needed social services. Thus, the variety of programs that serve our clients will be seriously compromised and jeopardized. And we're already seeing that happen, obviously, in California.
And so we have to focus on how do we adequately reimburse providers to ensure that they remain solvent and continue to provide the care that's being offered. And also reimbursement across communities. We hear that there's differences even with the Medi-Cal program in terms of the rates here in Southern California versus Northern California. So there needs to be more equity in the system as well. The second thing with reimbursement is that we have to have models that promote both quality and efficiency within the system. Things like providing care at the appropriate setting, getting people out of the emergency rooms into physicians' offices, into clinics, offering pay-for-performance systems and reimbursement models, looking at bundled payments across providers as we look at an episode of care from pre-hospital, hospital, and post-hospital care and how we pay each of those providers. Encouraging that best practices get shared across the system. Promoting transparency in the system, so as the consumer, they know what the cost is of a procedure and they can compare between providers based on quality and cost and price metrics. Removing regulations that inhibit quality and efficiency. We get a lot of regulation out there that costs providers, but it's not funded. It's an unfunded mandate, and so that's additional cost that providers are now having to assume. Reimbursement structures that encourage collaboration between providers, and also reimbursement structures that implement good disease management programs and prevention programs that are built into reimbursement. And then lastly, ensuring that reimbursements keep the system as a whole solvent. And the big elephant that's always in the room that people don't like to talk about is Medicare. That system is going down a path of financial disaster. If we look at some of the projections, they're projecting that based on the number of eligible members coming into the Medicare system, especially now with the baby boomer generation, the system's projected to go broke by the year 2017. So we have to look at how do we get these costs under control, looking at new reimbursement models with any healthcare reform program.
Do you see those as logical things for national reform to focus on, or do you see some of them as either something for states to do individually or for private sector and competition to do? Because it's hard for me to see the federal government sitting down and saying, let's pay providers this way, and let's do that in Arizona and New York and Massachusetts, and we're going to do it the same way across the board. That gets hard. Different. You know, nobody's got our California medical groups, for example, that can do certain things that others can't do. How do you break that down between governments, federal, state, and private?
One thing though too, we have to be careful when we're talking about reform, especially reimbursements, is that it doesn't get tied in with the local politics. And we've seen this happen here in California recently with the budget crisis, where with the Medi-Cal program, they held back reimbursements to providers. The clinics were suffering, the hospitals were suffering because it was caught in that whole budget battle. And so we have to be careful with any kind of reform going forward, as we're looking at expanding coverage, that it doesn't get caught in some of those state political and local political battles that happen as well, where the providers are then held as hostage in this whole political fighting that goes on between the parties and with the budget and financial issues.